There we go.
Over to you, Ed. Well, welcome to our, there you go.
All right. Everybody was frozen for a second there. Go ahead. If you've already started, yeah, go ahead.
I really didn't, but yeah, hey,
Okay.
welcome to our eighth SF4Life webinar, where we get topics from our members that we like to share with the community, knowledge, tactics, things that we've learned to share with our network, bring experts in from the outside to share that knowledge with us. And this particular one, Brandon Bellman, is our key speaker, and JD's going to give some insight as well, JD Morris. And so with that, Brandon, if you want to give yourself an overview, and over to you.
Yeah, thank you, Pete. So my name is Brandon Bellman. I'm a physical therapist. I specialize in the tactical athlete, so that includes military, law enforcement, fire, first responder, armed professional. Um, so soon we'll talk about um, injury mitigation, how to keep exercising, and all the benefits that has. Because I don't care how old or broken you are, you need to keep moving. Um, is JD in here? I don't know if JD had anything he wanted to start off with, or if I should go right into it.
No, go right into it, brother.
Cool. All right, let me share my screen. Nope, don't want to click that. All right. You guys let me know if you can see the PowerPoint.
Good to go.
Good to go. All right. So we're going to talk about holistic health, because that is my expertise, is movement. So I call this Move with Purpose. So little background again, I'm a doctor of physical therapy, and then my other profession is as an athletic trainer. If you care about where I went to school, all of it here in Ohio. Um, most of my experiences with first responders and tactical athletes. So a lot of law enforcement, members of armed forces, from uh, our armed forces to allied armed forces like the Australian Air Force, combat athletes, and was a former professor. So if you have questions or care about credentials or anything like that, you can ask me later, but we'll get right to the good stuff. So our objectives. Um, so as I understand it, this is a group predominantly for SF personnel, mostly retired or previous serving. So I want to go over, exercise after the service, being successful in doing so. We're going to go through the benefits physically, mentally, and in your community. Uh, because I'm assuming almost everyone in here has some form of pain or previous injury, we'll cover some chronic pain and management, and then some training strategies that I personally implement with my athletes. Anyone from age 18 to 75, I don't care how old you are, we can implement these things. Just that starting point might look different. As we go along, I can't see everyone's faces. So if you want to shout and ask a question or save them for the end, whatever works for you. So exercise after the service. So exercise what it doesn't need to be after the service. You don't have to do stupid early workouts. If that is not what you like doing, don't do it. It doesn't have to be calisthenics. There's not that calisthenics are superior to weightlifting or weightlifting is a higher risk of injury. It doesn't need to be strict, non-modifying, and unenjoyable. You know, some of you may have heard of like 75 hard, um, which, is beneficial for a lot of people, but it's very strict in trying to achieve an absolute perfection in healthy lifestyles really isn't sustainable. And exercise does not need to make you sore for it to be effective. But what it should be is enjoyable. It should be regular. It should be challenging. And if you have the opportunity, it should be done with other people. Um, so what is required to be successful in achieving any fitness goal? Consistency. Without consistency, your body cannot adapt to get stronger, faster, have those beneficial health outcomes of, improved cardiovascular health, respiratory health, improved neurologic health. And so there's three external factors you can focus on to improve your consistency. So all of this is supported. I applied some articles below that will share this. So planning ahead, if you have something that you know you're going to do, like having an exercise program implemented, that is going to make you much more consistent. You don't have to guess. You don't have to have an excuse of, well, I don't know what I'm going to do at the gym, so I'm just not going to go. Social support, so including others, enjoying the camaraderie of a workout, or having that additional accountability, another way to stay consistent. And then enjoyment, do what you enjoy. So it doesn't have to be a grueling, 12-mile ruck. It doesn't have to be a CrossFit workout. It doesn't have to be a bodybuilding workout. If you want to go play some tennis, some pickleball, like do things you enjoy and do them often. So some of these to the core, everybody knows this, but I just want to share some statistics that are relevant to the group. So physical benefits, obviously weight management is a huge benefit of regularly exercising. So when we look at some VA data, 24.7% of veterans, once they leave the service, are not overweight, meaning about 75% of veterans are overweight or obese. So when we consider all of the comorbidities that can follow with having a high BMI, we need to change the culture of exercise among our veterans. Prevent and mitigate. So some of the big scary things that start to increase, one, just by being a veteran and having no other injuries or risk factors, that enough will increase your chance of developing these. So a stroke, so anyone who has previously had a TBI, your risk of stroke exponentially goes up. So how do we combat that? A healthy lifestyle, and that starts with, exercise as being one of the easiest, most attainable ways. Metabolic syndrome. So that's a whole list of items. It usually comes before the onset of diabetes. So preventing diabetes, 25% of people in the VA have diabetes. High blood pressure, one of the risk factors for odds of stroke and other cardiac events. 48.2% of veterans that have been evaluated at the VA have hypertension at that time of assessment. Cardiac disease, heart failure, mental health disorders. So 38% on record have mental health codes on their VA file. Odds are it's significantly more than that. And then cancer, the VA gets 50,000 new cancer reports or cases yearly. So there is no shortage of cancer going along. Now, it doesn't matter what type of cancer, exercising can be a reducing risk factor. Now, it can't absolutely remove that risk because sometimes it's genetic, or exposure based, but it can reduce that overall risk. And plenty more that I don't care to list because you guys will fall asleep. So the other benefits, increasing resiliency, strength, speed, power, capacity. You can improve your bone density with exercise, improve blood flow. You can make your tendons strong, your cartilage strong, your ligaments strong. Another big thing. So I'm assuming most of these guys have some form of chronic pain. And when you exercise, you can reduce that. And when we look at people with chronic pain, 85% of people with chronic pain are going to experience severe depression. So doing things that get you out of that pain. Fatigue, if you're feeling tired more than you believe you should, exercising, improving your capacity for the day. And then also being strong is never wrong. Exercising often is one of the best things you can do to reduce your risk of injury. So that's just physical. We go to mental. So more on the performance side, processing speed. How fast can you assess a situation? The better you are aerobically, your brain can process certain factors faster because stress is not an impeding barrier or decreasing that processing speed. Same thing with executive function, cognitive function. So all of these mental benefits, neuroplasticity. So the actual changes in the neurons and the pathways of your brain can be improved with exercise, and that can also affect PTSD related symptoms. When we look at PTSD, exercise, things that arouse your sympathetic nervous system, that repeated but therapeutic arousal can desensitize these responses that we often see when individual experiencing a PTSD episode would have. We can desensitize the severity of those symptoms. Mood, self-esteem, feeling better about yourself, perception of health status and quality of life. So it doesn't sound like much, but if you feel like you're doing well with your health and your quality of life is good, just manifesting that thought has profound outcomes on your life. Stress relief, improved sleep, decreased risk of cognitive impairment. So that's things like Alzheimer's, reduced incident of depression, and looks like I wrote it twice, perception of health and quality of life. So doubly important. Community. So group-based exercise reduced depression, anxiety, and promoted sense of belonging than control groups, as well as group-based exercise reduced symptoms of PTSD compared to independent exercise. So that's just a video. These are actually some officers I was working with, but getting into it, like I said, working out with others is one amazing way to stay consistent, but it's also another way to, be helpful to your brothers. So, if you're not the talk about it kind of guy, like just invite them out to a workout. Like it can be as simple as working out. So next part of this I call myths and bullshit about back pain. So we're going to talk about what back pain is, what it isn't, some easy ways to address it. So at any given time, it's estimated 15 to 20% of adults are experiencing back pain in the year. About 50 to 80% of people are going to experience back pain. And you guys age like milk. So I'm going to say that's about 100% of you guys either have or will experience back pain. So when we're looking at, hey, what types of back pain are there? The most common we're going to see are strains. So that's something with the muscles, the tendons of the back. Usually they're going to be felt off to one side. It can still be in the center, but one side's usually worse than the other. Sprains are related to your ligaments, discs and stenosis. So a lot of people hear, hey, I've got a bulging disc or disc degeneration. I've got the spine of a 90-year-old. Those are very normal, and we'll actually go through some studies on that. Fractures. Now, traumatic fractures are nothing to mess with, but there are some overuse fractures or acquired fractures over time that aren't too traumatic. They're actually pretty normal when we look at them. And then radiculopathies, if you've ever had anything like nerve pain shoot down the leg, that's also super common. So, myths and bullshit. So, the myth that you have to maintain upright, shoulders back, head up posture at all times. That is a myth. That is BS. There is no perfect posture. So if we look at point number one, there's no association between kyphosis and levels of pain or disability. So kyphosis just means the rounding of your back. So if you're sitting slouched compared to someone who's sitting upright, there's no indicator that you're going to experience more pain than the person who sits upright. And if you've ever tried to maintain upright position for multiple hours, you're going to be just as damn sore as the person who probably slouched for multiple hours. So there is no one posture that is better than others. So when we look at adjusting back pain, improving back pain, what is most comfortable is the best posture. So if you've been slouching for 20, 30 minutes, an hour, 2 hours, then it's probably good to say, hey, I've been in this position for a while. I should probably find some way to move, whether that means getting upright or standing up, walking around, and getting myself in different positions. So, what the research does say is sedentariness has the most detrimental effect, but can be reversed with exercise. There is no wrong posture, there is no right posture. The best posture is your next posture, as in you just have to stay moving. So, if you find yourself slouching, come upright. If you've been upright for a while, let yourself slouch or lean off to the side. All are good. Nothing is going to make you inherently more at risk for back pain. So let's say you hurt your back. Most people end up, resting, feeling, hey, I'm gonna lay up, shut everything down, and that's the best thing to do. And that's pretty sensible until we look at how our body actually recovers. When you do absolute rest, what you're going to do is you're going to decondition. All of your muscles are going to get weak. Your nervous system is going to get more sensitive to whatever stress you put to it. So we have to think about trying to maintain tissue capacity and general health by finding movements that are comfortable and not exacerbating pain, and just meeting our function with where our pain is at. So absolute rest is not the best answer. And early exercise is one of the best things you can do to reduce pain intensity, reduce deconditioning, and ultimately try and fight turning it over into a chronic pain. So I have this poorly drawn graph that I did on the bottom right. So the green line is the activity. You can think of it as the demand you place on your body. And the blue is your capacity. So it is, what your body can withstand or tolerate. So anytime we ask more of our body than it can tolerate, we have a breakdown in the system. Something gets injured, you pull a muscle, a disc gets bulged, something happens. So if you absolutely decondition, you see that first drop off in that recovery in the white. So you do absolute rest, and what happens is we start to see a gradual decline in that blue line. So what you can tolerate starts to go down as you decondition. Then you try and ramp your activity up after you took, a week, 2 weeks off of doing whatever, and you just hurt yourself again, but it didn't take as much to do it. So you do some active rest. So you decrease the intensity, the volume of what you do. It might not look glamorous, but you're still moving around. And that's going to allow you to keep increasing capacity and deconditioning or prevent deconditioning so that by the time you start increasing that activity again, you are not overwhelming the system, not asking a higher demand than what your body can supply. So absolute rest, within the first 24 hours, sure. But after that, you need to find ways to move. So again, I can't see everyone's face, but I'm sure people have heard, hey, deadlifting's either bad for your back letting your back round is bad for your back and your discs are going to explode. So that is, for the most part, a crock of crap. Disc injuries are not a death sentence. Lifting doesn't need to be as scary as some make it. So if we go to point one, so discs are adaptable. They will respond and adapt to the forces you do or don't apply to them. So if you are on absolute rest or you're not exercising, your discs are not going to, maintain the resiliency. So sedentary individuals have higher rates of disc injury than active individuals. So your discs do adapt, they do heal. So we go into point two. Disc can heal without surgery. So if you've previously had an X-ray or an MRI where some surgeon, chiropractor, or someone was like, wow, this looks like shit, you're not going to be able to do heavy lifting ever again. That is not true. Discs can heal. Now, it takes time when we consider what the disc is. It's a very strong tissue, but it doesn't have a great blood supply. So that healing time does get closer to, you know, 8 to 12 months, sometimes a little longer, sometimes a little less, depends on the severity of it. But they do heal. And then we look at top three causes for disc herniation. So genetics, so you have no control over that. Sedentariness, you have absolute control of that. Occupation, and most of you guys, I'm assuming, are retired or on your way out. So kind of too late to pick something else. So the big modifying factor we have is not being sedentary. That's the best thing we can do to avoid some disc injuries. Number four, so I mentioned not rounding your back. So you cannot avoid flexing your spine even with the most perfect form. So there's some studies that look at people who do a squat or a deadlift and they actually put them under an X-ray. And even with what is quote unquote perfect form, some degree of flexion still happens at the low back. And then we look at people who train to the extreme, like your strongmen and your powerlifters. And if you watch them in competition, most of these guys have rounded backs while they do it. So this isn't a call to say, hey, I can only deadlift with a rounded back, but with appropriate progression and training, you can improve your tolerance to load so that you don't have to be concerned, hey, that's too heavy. I need to accentuate the specific form. More so, get strong so you don't have to worry about it and you lift the weight and you don't have to think about it. So low back pain case, one of my recent patients, he was an LT at a local sheriff's office. So he was 52 years old when we started. Multi-level stenosis, so the actual spaces where his nerves leave his spine were closing in. He had multiple levels of disc degeneration. He had 2 partial knee replacements. He was experiencing chronic pain for the past couple of years and had failed physical therapy and a failed laminectomy. So that's where they actually remove part of the spine to try and make room. And because none of those worked, by the time I met him, they were planning a multi-level lumbar fusion, an anterior approach. So if you know what Tiger Woods had, it was the same thing. It is not uh, a simple procedure. It is pretty aggressive. And with just 6 weeks of physical therapy, I hadn't cured him yet, but it was enough where he felt comfortable to uh, deadlift for the first time since high school, which his doctor said he'd never deadlift again. And he actually was able to cancel that surgery. So you are adaptable. Back injuries are not a death sentence. It's just a matter of getting moving, knowing how to progress and where to start. Low back pain and imaging. So if you guys have been through the healthcare system, I'm sure a lot of you have had x-rays, MRIs, and you might have heard either, hey, your spine is the worst one I've seen. It's a 90-year-old spine. or you might have had back pain for a while and they told you, hey, actually,
also
your
by
back
Israeli companies. In 2022, a company called Smart Shooter based.
So when we look at some studies for people who got low back imaging, so point one, uh, I think it was about a study of 4 to 5,000 people um, that got MRIs because they had low back pain. Only 4% of those 5,000 people actually had something on their MRI that said, hey, this is abnormal. There's a structural deficiency here. That's not to say these people were faking their low back pain. It just means that imaging doesn't tell the whole story. It is a snapshot in time, typically a 2D image. If it's an MRI, it's a bunch of slices of 2D images, but our back moves and it's a static image. So it doesn't tell the whole story. And then point two, the presence of spine degeneration is found in most people with no pain or disability. So we're going to take a closer look at this study. This one, I believe, was around 4,000 people in the study who had zero back pain, no history of back pain. So in the blue is disc degeneration, in the red, disc bulge, yellow, disc protrusion. So they're actually having some substance moving out of the disc. Green, facet degeneration. So that's the actual joint space between your vertebrae. And then a spondylolisthesis is a long word for you have a fracture in your spine. So once you hit 30 years old, even if you have no back pain, I'm going to expect 50% of people to have some form of disc degeneration. And that only goes up about 10% every decade. So a lot of times when I see someone with back pain, I could care less initially what their x-ray or their MRI shows. I'll consider it, but a lot of times it's going to tell me a lot of something that is present but might not have anything to actually deal with the source of pain or why they've had chronic back pain. So when we consider this study, this is all people who have zero pain, 100% function, no history of back pain. So these things are normal to see. They should not scare you. They should not say, hey, I'm done doing X, Y, or Z. I'm never going to touch a free weight again. I'm only going to do, uh, light cardio. So I'll rip through these pretty quick. So these are advanced clinical practice guidelines from my profession, so physical therapy. And it's just to send that point home. The best thing you can do for chronic low back pain, it's not surgery, it's not medication, it is exercise interventions to strengthen your back, improve endurance, and get yourself moving. And again, we circle it. Education's a big role. It's kind of what I'm doing right here with you guys. I'm letting you know, hey, sometimes what you're experiencing doesn't always have to be a structural abnormality. Your nerves can be sensitized, and that can be the source of pain. And then active treatments, whether you enjoy yoga, whether you like Pilates, or you like being in the weight room, I don't care what it is, just some form of movement is going to be the best thing to address the pain. And again, we look at it, groups that receive muscle strengthening and endurance exercises have greater improvement in pain compared to self-care groups. So I know I talked about the back just because I assume most people have back pain. It's one of the most common injuries. We can apply these same approaches to almost every joint, every muscle. So if something hurts, assess the movements, find out, hey, what is provocative? When I bend this way, it hurts. When I extend this way, it actually feels pretty good. So, hey, do more of that non-painful activity, getting your body moving. That's going to help your nervous system calm down, say, hey, I can move. I don't need to be on high alert. Stay active. So one of the biggest things in research you can do to improve your pain, whether you've got chronic back pain, chronic shoulder pain, just doing low load aerobic exercise. So improving your cardiovascular health can also desensitize your relative perception of pain. Reevaluating often. So, you might expect, hey, it's hurt to bend forward for about 2 weeks. But if you're moving often and desensitizing the nervous system and healing, then you might be surprised at how soon you can go into those previously provocative activities or movements. And then back to that one graph I was laying out, don't create a demand higher than what you can tolerate. So that just means be smart. Don't go from 0 to 100. Give yourself a smart progression of, hey, I'm going to start running again. And so I'm going to start with, a 10-minute jog. And instead of going from 10 minutes to a 30-minute jog, maybe I'm only going to increase my weekly volume by 10%. And that is my method of progression. So I don't exceed what I can tolerate. And so what that progressive load looks like is different based on your injury. It's different based on the structure and how often you are actually staying fit and taking care of yourself. So sometimes it's days, sometimes it's weeks, and sometimes it's months. So I bring up this graph just to send it home. This is for injuries, but it also applies really to how long does it take for certain structures of my body to adapt? Because that's all training is. It's providing a stress that you can tolerate and recover from. So on the left, you have the type of tissue, and then along the right, these bars on the x-axis show, hey, this is relatively how long I would expect this to heal. So when we're talking muscles, sore muscles, which that's what DOMS is, a couple days to some more aggressive strains, we're looking at weeks to a couple months. Tendons, so tendons don't have as good of blood flow as muscles. So that timeline takes a little bit longer when we get into that subacute chronic overuse stages. So if you've got tennis elbow, jumper's knee, golfer's elbow, these things can take up to a year, and that's totally normal. There's really nothing you can do to heal faster. Now, you can do things to make it worse, like be sedentary, but if you want to optimize that healing rate, staying active, keep it moving. And then similar with ligaments. So usually I do this part in person. I'm going to stop sharing my screen for a second. Let's see. Can you guys see me right now? All right. So if you've been sitting for a while, let's all back up. Let's stand up. Let's get out of our chair if you can do so. Let's kind of reach for the sky. Let's stretch around. Because I said the best posture is your next posture. So moving often is better than being sedentary. So I'm going to drop a link in the chat real quick. You don't have to pull it up now. If you sign up later, I'm going to share all this stuff with you guys for free anyways. But it's just a checklist if you want to make notes down the line. So I don't forget, there's that link shared. So we're going to go over this low back checklist. You don't need to pull it up. You can just watch me follow along. So like I said, you want to assess what ranges of motion feel good or bad. So first thing I want you to do, anything that hurts today, don't feel like you have to force it, but let's just bend down, see how far you can run your hands down your legs. Hang out there for a couple seconds, and then bring yourself back up. Now, if it hurts to get down or get up, hey, that's an area of discomfort. Maybe make a note on that. I need to work on that. I'm sure most of you guys are muted, so we didn't hear most of the grumbles and groans on your way up. Next, I want you to put your hands on your hips. I just want you to arch back. Don't fall over, but arch back. How does your body tolerate extension? So usually extension, it depends. You either love flexion or hate extension, or you love extension and you hate flexion. Next, I want you to take your right hand put it on your side. And I just want you to try and run your hand down your leg. Can you touch your knee without bending forward? That's usually a good landmark we look for of range of motion, bending to the side. Let's try to the other side. So left hand on your left thigh, run it down the side. Cool. Can you touch your knee? If not, maybe that's something we need to work on a little bit. All right. And then we can all sit back down. Now, while we're seated, I'll have you guys cross your arms. And I just want you to rotate. Can you clear your elbow from your midline? Rotating both ways. That's usually a good landmark I want to see when I assess someone. So if it's painful, hey, maybe that's something I need to work on. These are also great movements. Hey, I've been sitting for a while or my back's stiff. Like, run through this. Give yourself a quick assessment. What can I tolerate? All right. So there's some other things. If you download that PDF, if you have questions about it, ask me. We won't be able to do all the tests because some of it is a hands-on. I want to show you one more stretch while we're here. So while you're sitting, you can do it sitting. I want you to take one hand, put it between your knees like this. And with your other hand, you're just going to reach over and try and reach your hand over as far as you can. So you should feel a stretch in your low back off to the side. So this targets a muscle called the quadratus lumborum. A lot of people, I would say a majority of people, when you're having one-sided low back pain, that is what it's going to be. So see if I can get a little further away so you guys can see it from the side too. So my hands between my knees, I'm kind of turning my chest, and I'm reaching over, trying to lengthen everything over here. So that's an easy, hey, I don't even have to get up to stretch, but I can start moving my spine. So I'm sure everyone's wife heard them from the other room, because you guys probably could benefit from moving more and your back's probably hurt. But we'll get on. I'll save you the rest. If you have questions, most of the names on that PDF, if you Google it or you YouTube it, I'm sure a video will pop up so you can try it yourself. And if you're struggling with it, shoot me a text, shoot me an email, and we'll hop on a call and I'll help you through it. All right, let me pull my presentation back up. All right. Let's see. Let's hope it starts from the current slide. Let's try this one. All right, we should be back up and running. So that's my quick and dirty low back workshop. If you've got back pain or down the road, you lift something, your back hurts, find what feels good, do more of it, find what hurts, respect it, don't push past it, and then reassess daily. See if you can start moving a little bit further within comfort in those ranges that were previously painful. So the performance, the training side, the stuff I really enjoy getting in the weeds in. For you guys, you're the warriors in the garden. What should training look like? And training doesn't need to be much different, even if you're 50, 60, 70. Now, how we recover from that and choose to progress might be different, but the things we do, if you do them right and you progress smart, You can still be doing athletic things. So some terms we get thrown around, hybrid training. Um, Typically, I hear, why would you do it that way? And why is it good for tactical athletes? So traditionally, hybrid training was a method that you say, hey, I want to do two things. I want to get really strong and I want to get my endurance up. So usually you'd find someone who was doing a bodybuilding program and they're like, cool, I'm doing this really intense bodybuilding program. And then I stole a program for marathon runners, and without modifying, I'm just going to smash them together. And so you'd hear the common things in, gym bro talk of, hey, running's killing your gains, or, getting strong is making your running worse. And so scientifically, we call that the interference effect. And so when you're doing these high level things without smart progression, you will interfere. And it's not because one takes away from the other in adaptation, it's you're just overflowing your cup with stress. So why should you train different focuses? So each one has its benefits. And being a tactical athlete, someone who wants to be able to perform on demand, every situation, context, response is different. So being competent, a jack of all trades, if you will, at different types of activity is what you want to be training. So training qualities, speed, agility. I don't care if you're 65. Yes, we can still do sprint work. Power, capacity. So capacity is, doing hard things, but how long can you do that hard thing? Strength and aerobic endurance, considerations, all of this stuff, you should take in consideration what your strengths and weaknesses are. What is your injury history, and if you have any required modifications? And then when we're looking at, the working tactical athlete, what does their specific role demand? And so that's how we can individualize some of this stuff. I'm going to give you the bare bones. How do you implement it? And why is it important? So again, that interference effect, it's not because getting strong makes you a bad runner. It's usually hey, if stress is the water in the cup and I'm just smashing multiple programs together, I'm probably overfilling that stress more than my body can recover from. And that's where you get interference. So the art of being a hybrid or tactical athlete, being good at many things, is you need to know where to adjust the dials of, hey, I can turn this up, and by doing so, I need to dial this back down. Not because one is better or worse than the other or interferes, but you just have a limited capacity. You can grow your cup. The more fit you get, the bigger your cup can get, meaning the more stress you can handle. But a lot of time, people do too much too soon. They fill their cup up way too fast. They get an injury, and then it's just a vicious cycle. So speed, power, and agility. So probably the most neglected training quality. Most people, once they get out of high school or college athletics or, basic training or anything that has them, regularly sprint, they stop doing it. So speed, distance over time, power, work over time. So work is just, how much force over distance, agility, your ability to accelerate, a change in velocity over a change in time. The common factor is time. So when we think about training, we want to consider the principle of specificity. Super simple. Everyone understands this. If you want to get fast, you have to do fast things. I've seen many people sprinting well into their 50s, 60s, and 70s. And the best thing I heard is I sprint at 53 because I sprint at 53. It's very simple. If you don't sprint, you're probably not going to be good at sprinting. So if you haven't sprinted in a while, your odds of straining a hamstring out the gates trying to do 50-meter repeat sprints is probably very high. Now we can get you up to doing that, and there's a lot of benefits in doing so. but you need to find where you're at, apply appropriate progressions, and then get back to it. So how do you implement it? So it's high intent of movement. So meaning high speed. So if you're in the weight room and you want to program a speed day, maybe you decrease the weight of the bar or the dumbbell or the kettlebell, whatever method of loading you are using, even if it's body weight. And your goal is, hey, I'm going to keep my relative volume low, 2 to 4 sets of 2 to 5 reps. I'm going to make it so I'm not going to let fatigue slow me down because I'm not doing a ton of work. And I'm going to move that bar fast. You don't have to be fatigued for this to be effective. Most of the time, if you're getting super fatigued, it stops being a speed workout and you start making it a capacity workout. So speed, power, agility need to be fast. Sprints, do them. So for most of you guys who probably haven't sprinted in a few years, or if not many years, I don't suggest you try and actually sprint 100% effort. What I would say is, hey, let's start with 10 yards and let's start with like a fast-paced jog. And let's do that for, a few weeks to a couple months. And then let's progress to 30 yards. And then we can start increasing your intensity. That's going to allow you to adapt. When we start thinking about, hey, how fast do muscles and tendons adapt? Well, muscles adapt pretty fast. It still takes a couple weeks to months. Tendons take longer. So when we're considering safety of progression, we're doing high speed things. That's where tendons tend to break down. That's why you see most people, the easiest example is everyone after age 30 is going to tear their Achilles when they start playing tennis. I don't know why it's tennis, but it's usually a quick side to side movement. If you don't train sprinting, you don't train jumping or agility, that's where you're going to see breakdown because you're asking more of the tissue than it can handle. So same thing, agility and plyometrics. So agility, just moving fast, changing direction, plyometrics. So jumping, repeated jumping. They can start easy. So agility could literally be, hey, I'm going to take one quick step to the left. Wait a second. I'm going to take one quick step to the right. Take a second. Plyometrics, multiple repeated jumps. Ultimately, that's what I work people up to. But that can be like a double leg. So it could look very simple like, hey, I'm going to do 10 jump ropes and then take a break. That is such a quick loading of your Achilles tendon and your calf that they're experiencing 5 to 7 times your body weight when you're doing that. So let's start low. I would say most people here could probably tolerate a couple, jump ropes or even a few imaginary jump rope. These are things we can start doing to prevent future injuries, but also make you, hey, I'm confident if I needed to run to, go catch my kid falling or get out of a situation, I'm not worried I'm going to tear a hamstring, tear an Achilles, and then be a liability. So capacity. So capacity is a little different than endurance in the fact that it's volume and intensity. So it's not just how long you can work, but how hard you can work. So this is something, hey, if we're going to implement it, you probably don't need to do it more than once a week. I like high intensity efforts. So that means if it's truly high intensity, you can't do it for long. So usually starting at, 30 to 45 seconds. And then when we start to progress, maybe we can build it up to 60 to 90 seconds. So pre-workout, here's one thing I do with a lot of my tactical athletes is lactate intervals. So your first round, you're going to do 30 seconds of work. I really like bikes. Bikes limit contacts on your feet if we're already doing a good bit of running. So here's one easy way. Hey, it's pretty soft on your joints. You can make it swimming. You can make it whatever you want. 30 seconds of hard work, and then you get 2.5 minutes of rest because you need rest if you're actually going hard. Then sled pushes. Again, I like sled pushes. They can be relatively light. 30 seconds of work, 2.5 minutes of rest. I like sprinting. Here's an opportunity to get some sprinting in for your week. 30-second sprint. If you haven't sprinted in a while, maybe you repeat a bike or you repeat a sled or you hop on a rower. It doesn't have to be these same modalities. Then you get 7.5, 8 minutes rest. A lot of my tactical athletes, hey, you want to stay sharp on some skills? You're now in a stress state. Let's practice some dry fire. Or maybe you want to work some tourniquet application. So whatever skills you still want to be proficient in, this is a great time to do it in a stress state. You've got 7 to 8 minutes, and you're going to do this for 2 or 3 rounds. So now you've got 2 to 3 rounds of 7 to 8 minutes that you can acquire probably like 100 reps. So now, like I said, you can change the ergometer. I don't care what form of exercise you do. I just want you to prioritize the intensity and the time. And rest is key when you want to do that principle of specificity. So be very intentional and move with purpose. So benefits. So immediate action events, lactate threshold, which on the exercise physiology side just means, hey, what is your total fitness and cardiovascular health, like all the stuff we mentioned before. You guys can stop me at any point if I'm going over. I am not really good at checking the time, but strength, I'll go quick. Strength is simple. Most people like this one, they got this one down. It just means moving heavy shit. So strength is force, and force equals mass times acceleration. Usually we're playing around with the mass component. So lifting heavy, usually that's your compound lifts, bench, squat, deadlift, but you can apply it to every movement. The big thing is allowing rest. So if you're only resting 30 seconds, you're probably not lifting heavy enough. Now, if you have pain, we can make some other modifications, but rest is very important for deciding how intense you can go for subsequent sets. So what should it look like? 2 to 5 sets for, 2 to 8 reps. Machine or free weight, there is no right or wrong answer. Both are great. They're just what tool is more useful or more comfortable for you. And when applying these things, I like full body versus bodybuilding splits or upper lower splits. That just allows me to hit multiple body parts, 2 to 3 times a week. But in each session, I'm not doing, tens and tens of sets. I'm only doing, maybe 3 to max 8 sets per muscle group. So I'm not terribly sore usually after my strength sessions, but I get to hit it more frequently. Aerobic conditioning. So VO2 max is the common metric. How well can you consume oxygen? The more oxygen you consume, the more work you can complete because you can fuel your muscles. So how you should implement it. Zone 2 cardio, meaning 70% of your heart rate max. So you can even dial this down to something easier. Is it a pace you could speak, 14 words without gasping for air? So it should be relatively easy, low stress. Usually we want to aim for a minimum of 30 minutes, on the high end 90 minutes for it to be effective. It can be done on the bike, it can be done on the rower, it could be done swimming, whatever modality you want to use. Sometimes I'll mix it up and I'll do a combination of multiple. Intervals are a little bit higher intensity. So these are 3 to 5 minutes of pretty hard work. So like if you're trying to run a pretty fast mile, but then you get a good bit of rest, repeating it 3 to 6 times. And again, they don't have to be running. I like multimodal. So doing 1 round on the bike, 1 round on the rower, 1 round in the pool, or if you are going to run, 1 round on your feet. So how I like to break it down, and this is just an example, I front load a week with my speed, agility, power work because this high stress activity is usually where things fail. Most people jump off of something, they get hit with something, their tendons can't tolerate what that demand was. So I want to be fresh for this stuff. This is where your body's going to experience a lot of force in a short amount of time. And then we start to get, hey, I can do some strength, I can do some capacity, some more strength and aerobic endurance, that long duration. It's okay to be fatigued in the weight room. There's nothing wrong with saying, hey, I'm challenged at lifting 80% of what I felt I should have lifted. You're still being productive. You have to accept, hey, I'm slightly fatigued. I'm not going to perform as high. But I bet if you consistently did this for weeks and you let yourself shed off some fatigue, so you took a couple extra rest days and you tested yourself, you're going to be improving in all categories. And that's typically what I see with my clients. So again, I like it this way. So you do the hard stuff with low fatigue, and then as the week goes on, it's okay to be fatigued with this stuff. And then the consideration of auto regulation. That's just our way of saying changing the week, the workout, or your plan based on how you feel. So if something's really sore and painful when you do it, don't do it that day. You can say, I'm going to switch my days around. Or, if you're still working and you're like, I slept like crap, I'm operating off of, repeated less than 4 hours a night. Hey, maybe the best thing you could do that day is take a nap. So basing your training on the long term, how you feel, is going to allow you to make more adaptation. Because if you take one day out of the week for a nap, but then we take this whole week, so these 7 days, and we apply it to months, that one nap really isn't going to set you back if it let you, train a little better on the following days. So if you're hitting 80% of what your plan is, usually that is a minimal effective dose. So you're going to get the same adaptation, improvement, performance as if you hit, 99% of the workouts. So doing what you need to stay consistent is better than being perfect, because perfect typically burns out. If you guys want to get your phones out, this QR code should send you to a little sign-in sheet. It'll be like, what's your name? What's your email? And I might ask you if you're interested in learning about anything specific. But once you sign up, I've got a free ebook with a bunch of different authors, from me, a dietitian, a sports psychologist, a clinical counselor, firearms instructor, bunch of fun stuff. It's all about tactical athlete health and wellness. You'll get that for free. You'll get an invite to a Facebook group. So the Facebook group is all vetted tactical athletes, and the only non-tactical athletes or first responders are going to be clinicians or content experts, where you can ask questions. Hey, Brandon, I hurt my knee. What's some quick stuff I can do? Or we've got a chiropractor in there. We've got all of these different healthcare professionals. And then as any free resources come out, you'll get put into a email list so you guys get all that stuff right away. If we need to see it again, let me know. So I will open it up to questions, and I'll leave this up if anyone needs to see it. That's just my contact info. Again, feel free to text me, shoot me an email. My website's up there. Here's some things we do. If you want some guidance on anything, let me know. If I can, I'll give it to you for free. If it requires more work, we might have to do services, but I try and give out as much as I can for free.
Hey, thanks, Brandon. Hey, I put your basic info in the chat. Are these slides going to be available besides these the low back link that you sent?
Yeah, so I'll put a copy of this presentation, a PDF version. You'll get that emailed if you sign up, just so I can get all the resources to anyone
Awesome,
interested.
because every time we do one of these quarterly updates, we give the link and info about the previous one, which I put a link tracker on there to see how many folks are actually, oh shoot, yeah, I didn't know I missed this one, to see how many folks see it. Of course, it's only to our organization. We're not sharing it with anybody. And it's only those folks that actually read about it, hear about it, see about it, and have interest that would take a look at that info. So yeah, those slides, your link and information. We'll make sure that that's posted on our site. I
Yeah,
know
I
Chris
appreciate it.
Bell had a question. He hit me up on the side. Chris, over to you.
Thanks so much. And Brandon, thank you for your presentation. I have a kind of a complicated situation. My last jump, 7 of us landed in the hospital out of 11, and I broke my neck in 5 places, my low back in 3 places. I've had 7 major surgeries in the last 5 years. I can't do weights. The free, it's just, I've tried using the machine, so I didn't get a chance to hear any dialogue about the differences between weights versus machines.
So the simplest answer is machines are going to control your range of motion. That is one of the best benefits, meaning you don't have to stabilize much.
Okay.
It doesn't mean it's bad for stabilizer muscles. Those muscles are still active while you're using a machine. So sometimes it's just convenient, or you can load it more. Free weights. So there is a skill aspect of free weights. You know, the highest level is when you see powerlifters at the Olympics. That's a lot of skill. Now, typical free weights doesn't seem like it needs as much skill. But ultimately they're just tools for load. So that's all exercise is how do we load your tissue? So they both provide load. The goal is challenging load that we can recover from. So if your neck gives you issues with dumbbells, kettlebells, barbells,
Yep.
I'm fine with that. Like, let's do machines. Let's do some body weight stuff.
Okay. I
Right?
didn't mean to take up too much. I just didn't hear if I didn't hear whether it was okay in terms of the going in that direction as opposed to going just strictly with the free weights. And I've tried that and I just can't do it. It's just too painful.
Yeah. And I would say it's probably finding that entry point. So, traditional workouts might not be the best
Yeah.
entry point for you, but
Okay. Thanks so
finding
much.
that.
And
Yeah,
Pete,
absolutely.
great job.
Thank you.
Really great, good presentation.
I think JD had his hand up.
Yeah, I was gonna ask JD. Yeah, there we go.
Pete, Ed, thanks so much. Brandon, thank you. JD Morris, retired 5th Group team sergeant. I was medically retired in 2008 for post-traumatic stress and traumatic brain injury. For about 7 years, I was trying to drink myself to death, pill myself to death, and I was suicidal. First thing I can validate, Brandon, we met through a retired 18 Delta, retired U.S. Marshal, and actually he and I are doing training law enforcement in Ohio. And I got to meet Brandon earlier this year, and then just that retired Green Beret Marshal. He taught a federal law enforcement class in the Eastern Panhandle of West Virginia. And Brandon brought what he just did. And then what I'm into as healing is the mind, body, spirit. I've added emotional intelligence. And you probably already know why. And I do peer to peer because that self-destructing phase took everything from me twice, but family stayed and they shouldn't have. So Vietnam veterans are 99% instrumental in all of this. They were my first mentors at Camp McCall. So every step of the way in the healing process, they said, just like they did at McCall, Sonny, you're going to pay it forward. And I am. I knew that. So, but here's the thing, just stopping some of those symptomatic things. That was just the beginning. I had a lot of healing to do. So, like Brandon said about the holistic stuff, I have adopted that. And it has just taken me, I am I consider myself a retired tactical athlete. I was the weirdo that would come in the team room door in bike shorts and then go back out and run another 5 miles. And as I healed, I wanted, just like you said, I sprint at 60. I turned 60 this January. I sprint because I can. And I want to live to my youngest granddaughter is 4. I'm going to dance at her wedding. So, and a tactical athlete thing, it might not be for everyone. It's just a mindset. You Vietnam vets taught me that. So, my wife and I, we have a shooting and tactics business for performance shooting law enforcement. Don't get much military. Really wanted to train the armed citizen. And I was just tired of elite shooters underperforming. And I was still in my head a lot. So I got on the human performance side. I'm a neuroscience nerd, performance psychology, wellness psychology, resiliency psychology. And I found a lot of holes in my healing. But the thing is I also, a lot of the holistic stuff has healing powers. It also has daily performance or mindset enhancing powers. So my wife and I, we've added wellness, mindfulness, breath work, suicide prevention, stress management. Because when I do peer to peer, especially with our guys, I probably have about 100, 120 around the world in the last 8 years of healing that will still call time to time. I to this day, I believe they're all alive, but I find that they're bitter, polarized. God forbid they grab onto the geopolitical stuff, and it is hard to spin that around. And all I think we would want to see on them, the holistic or the medical side, is just have them be happy and healthy. So you can still do crazy shit, but be happy and healthy, and especially for your loved ones, because they take the brunt of this just like mine did. And I am huge on gratitude. Guy from Delta taught me that, Brad Halling. He was a mentor at one point when I was on a special projects team for SOCOM. He's got his place out in Southern Pines, and he actually has a foundation of gratitude. So practicing gratitude and humility every day is a healing power for me. Positive affirmations. I'm going to live till 90. I want to see those granddaughters. I want to run wild with them. So, hey, this is a good deal. You don't have to take it as far as, Brand and I and some of the other tactical athletes, but I've been on enough webinars on the tactical athlete side the last 3 years chasing this human performance. An Australian doctor said it best. He called bullshit on lower back pain too. Now, can't remember his first name. Bell. Yeah, please. That's unique. But he's like, really all we need to do is move and strengthen and move. And I mean, sitting at my desk, it can be like this, getting up more than I did yesterday. So, and here's the thing. I want to see you all. All right. I need you. I want you to see you at the reunions, and I'll come visit you on your front porch, and we'll shoot fucking, I don't know, pop cans or something. All right. Love you all. Thanks, Brandon.
Hey, Brandon, great presentation. Very thorough. I was waiting for what is the minimum, what do we need to what is the threshold that we're looking for? And you avoided that the entire time. Just do something, get up and get out there. I appreciate the assessment. If you're hurt, that's fine. Do other things to not lose the progressive work that you've put in before, to maintain that ability and just to get out there and to stay healthy. I love the tie into the mental health. I appreciate the nod to that, the psychological benefits and all the intertwining of it all. And without getting sucked into all that, just saying they're all connected. And if you want to start somewhere, start by getting active and getting out there. So appreciate it. Thank you very much.
Yeah, thank you.
And the only other plug I'd put in is if you have a topic or an expert or someone of you in the audience that aren't part of the SF4Life committee, reach out to Ed or myself and send in your thoughts on the topic so we can line it up. So thanks, Ed, for putting this together, and Brandon for your expertise, time, references and whatnot. Our community, and I know especially me, could definitely use this advice.
Yeah, thanks for having me, Pete.
Well, aloha, everyone. I'll hit stop and recording, and then anyone else that's got more questions, we could stay on further.